And good morning to you, St. Lucia. As always, thank you so much for joining us live from the studios of the National Television Network, the Government Information Service. I'm Lisa Joseph. It is Friday, and it is the 11th of February, and that means we are, I know what you're initially thinking, but no, we are halfway through to the anniversary of St. Lucia's independence. It is the 43rd independence anniversary. And what I think that you're thinking of, that we're very much drawing near to the matters of the heart. Valentine's Day is coming up on May 14. I know that for some people, that's a very, very important sort of anniversary period. But we're sticking to more national affairs. And hopefully when Monday comes around, we'll have a little treat for you. Right, Homer?
All right, Lisa. Well, it came from your mom, so
yeah?
I'm putting that one on to you, right? I'm not taking responsibility. Not taking responsibility for that one at all.
All right. Yeah. Well, and it's on me. How's that? It's
there we go.
Me.
That's what I wanted to hear. Lisa is going to be showing us love on Monday. Y'all heard it. Y'all heard it. Of course, we have to always thank you for joining us on the National Television Network. Those of you who join us on channel 122, our Facebook and YouTube channels, we really do appreciate it. And that is where you could always catch us for repeat programming, Government of St. Lucia on Facebook and YouTube as well. Yes, well into the calendar of activities for independence, we see quite a range of activities taking place, Lisa. Some
all the way to the March 13th.
Yes, just
about. So we have a month long and then some of celebration.
Yes.
This is great.
Yes, and a lot of the activities happening virtually. So not only can you and attend some of the activities, of course, there being limitations, the virtual aspect allows our St. Lucians in the diaspora to get involved and celebrate our people, as the theme suggests.
Yeah. And today, February 11, we're seeing the start of activities. We're having the Independence Baton. And that's an island-wide affair, and it's beginning at the north of the island. And it's going to go all the way around and come back to the north in Castro Central. That's going to be where the baton is going to, come to its resting place, if you will. There will be a celebration on the 21st, the evening of the 21st of February. And that celebration within the capital city is going to take us into Independence morning, which is February 22nd. I'm looking forward to that. Lots of excitement, entertainment. Our artists will be able to come out and perform, and just for as limited as the audience may be, for there to be an enjoyment on that front. And as you indicated, there will be that virtual aspect to it as well. Also today, beginning, there's the Independence Cricket Special. That's also happening island-wide. February 14, our Day of Love, a science snapshot. It is a full stamp competition that's happening within our schools. On the 15th of February, there's the Voices of Independence. It's a panel discussion series. That is also going to happen virtually. And here at NTN, we'll be bringing that to you. On the 16th of February is the renaming of the Entripo HRDC. And Homer, you have some integral participation in that. So I think a number of individuals are looking forward to that ceremony and in that renaming. And there is the Heritage and History exhibition, which is happening down in Vifor. And this one, I so love the name of it. It is Live Art, Live Art.
Yeah.
Which comes first?
I think it's live art, live art.
It's live art, live art.
But that was a nice play on it.
Yes. So you don't, whichever comes first.
Whichever comes first.
It simply means that art is supposed to be so integral in our lives that it is something that is very well ingrained in our DNA as St. Lucians. And so I am so totally looking forward to this.
So am I.
Happening at Constitution Park. It is something that we'll be bringing you as well. You want to pick up?
Yes, of course. We can also look forward to the book launch by McDonald Dixon at the National Cultural Center taking place on the 17th of February. That's a part of our Independence calendar. Also, the Praise and Worship Ecumenical Service at the Minor Basilica of the Immaculate Conception. That's taking place on the 18th. National Colors Day island-wide taking place also on the 18th, which I always look forward to. It's always quite a nice celebration. We could also see the St. Lucia Suite at the St. Lucia Suite is an event going to be taking place at Royalton. That's the hotel. Island Scholars, where are they now? That's taking place at the National Television Network. That should be very interesting to take a look at that. The 19th of February, we see launch of Blessed. That's a youth ministry. That's by the Labbe SD Church. So we see our communities and churches getting involved in our independence celebrations this year as well. Day of Praise and Worship within the various communities taking place on the 20th of February. Also from the 20th of February to the 22nd, at the Anglican School Annex, we're going to have a banana festival, which will be very interesting as well. From the 20th to the 22nd also, St. Lucia Showcase, My Island Home. That's taking place in Dubai, where we're going to see a number of our artisans heading over to Dubai and putting on quite a celebration, independent celebration over there as well. And on the 28th, we have launch of the Prime Minister's pitch competition right here on the National Television Network. We're going to be bringing that to you. On February 22nd, end of Independence Baton. So that is where the baton will end. We could also see the military parade taking place on the 22nd as well at the Sabin VG. And there's going to be a cultural extravaganza. So you can celebrate St. Lucia's independence and join us right here on the National Television Network for that. So that's events until the 22nd. And of course, we do have some other activities happening post the 22nd that we're going to keep you informed as to what's happening as we progress through the calendar of activities for Independence 43 under the theme Duva Sum, celebrating our people.
Yeah, and so, the usual with our COVID update before we get into some other main things for the morning.
That's right. The Ministry of Health, Wellness and Elderly Affairs, as usual, keeping us informed with our COVID-19 situation in St. Lucia. Yesterday, the ministry confirmed a total of 42 new cases of COVID-19. These samples were processed on Wednesday, that is the 9th of February, from a total of 309 samples, of which 219 were processed at the Ezra Long Laboratory, and 90 samples were processed at Laboratory Services and Consultations Limited. And these samples were collected from the 7th of February to February 9th, 2022. These number of positive cases makes 13.59% of all samples processed on that date. Confirmation was also received of the recovery of 189 individuals diagnosed with COVID-19, bringing the total number of active cases in country to date to 1,633. So we see a steady decline in our active cases since the start of the fifth wave right here in St. Lucia. Currently, there are 47 positive cases of COVID-19 admitted at the respiratory hospital. And just a little bit, we're going to give you a further update on the respiratory hospital. But the Ministry of Health, Wellness and Elderly Affairs yesterday also reported 2 new COVID-19 deaths and 2 new COVID-19 related deaths, bringing the total number of deaths in country to 263 and the total number of COVID-19 related deaths to 83. These deaths occurred during the period of January 18th, 2022 to February 4th, 2022. And of course, the Ministry of Health, by extension, the government of St. Lucia, sympathizes with the families of the loved ones of these individuals. Per usual, we remind you of vaccination sites. Today, you can get vaccinated at the VG Sports Complex, the Grosley Human Resource Center, the Zufre Hospital, the Jackmel Wellness Center, Inuke in VA4, as well as St. Anthony's Medical Center, and that is in Sunny Acres. And you can get vaccinated. You could visit any one of the vaccination sites between the hours of 9 a.m. and 4 p.m. We also did receive an update on operations at the respiratory hospital by Director Dr. Lucia Eugene Ford. So let's head over to that update on the respiratory hospital and its operations.
The respiratory hospital is a healthcare facility that has 130 beds, 15 of which are for ICU cases. This hospital attends to respiratory cases such as COVID-19, tuberculosis, asthma, and other respiratory illnesses. During the fourth wave, we had 826 patients being admitted. 80% of these cases were discharged. During this fifth wave, from the 16th of December until now, we have 383 patients being admitted, and we are seeing a similar trend of recovery of more than 80% of our patients being recovering thus far. While in the fourth wave, we had a lot of patients being admitted in the high dependency unit and the intensive care unit of the respiratory hospital, we note that in this particular wave, we do not have many patients who meet the criteria to be admitted in these two departments. A lot of the patients that come in, they do have COVID-19. They have flu-like symptoms, etc., but they come because of a different reason. They may have a mild flu-like symptoms and they're COVID-19 positive, but they come in because they're pregnant, they come in because they have a fractured hip, or it may be a gunshot wound, it may be an acute abdomen, and as a result, these individuals are treated at the Victoria Hospital because they do have COVID-19, they are COVID-19 positive as well. We have an active accident and emergency department because of the type of wave we have at this point. A lot of patients do come in because it's very Omicron variant is very transmissible. Lots of persons come in, but some of them do get admitted and a lot of others actually can go home to complete home isolation. What we had to do at the Victoria Hospital is open a swabbing clinic. Now, these clinics are something you would see at the primary healthcare level, the respiratory clinics. But we noticed that the majority of persons, or lots of persons, after going to the respiratory clinics, or so many persons going to the respiratory clinics, they came to the Victoria Hospital. And we try our best to assist persons, and we could not say that you cannot come to the hospital for just swabbing. Because it's a hospital, we decided to open a swabbing clinic where we have a unit with persons where you can come to get registered and get swabbed, sent home, and followed up thereafter. So that is something different from what we did in the fourth wave, but because of the need in this wave, we had to make that change to be able to facilitate the clients that are coming in. What we want to do as well is resume our medical outpatient clinic. That is something we had started in the earlier waves where we wanted to follow up the cases that are being discharged from the respiratory hospital. We all know that COVID-19 is a new illness, and as a result, we treat people in the hospital, but we always wonder, how are they doing after discharge? What complications? We wanted to make sure we have sufficient information about this new illness, and the medical outpatient clinic allowed us to follow up our patients that were already discharged. With the Delta variant, it made it a bit difficult for us to continue this because we had to have all our staff on board taking care of persons that were very unwell. At this point, we want to resume our medical outpatient clinic so we can follow up our cases. We're also looking into do a physiotherapy outpatient clinic because a lot of the cases who got COVID, got long COVID, and as a result, we wanted to make sure that they have respiratory rehabilitation. So that is something we're going to start off or resume to allow our patients to be followed up so we can have an idea as clinical persons, the effects or the complications that happen after one is infected with COVID, admitted and then discharged. So one would ask, after saying all of these things, Dr. Eugene, why so many deaths? Especially during the last wave. I mean, during the last wave, we had deaths, and we had so many persons thinking if you come to Victoria Hospital, you're going to die. And although we are aware from our data, which is what we go on, we had more than 80% recovery of our patients who had been admitted, but we had deaths, and persons were very worried about the deaths. And why come to Victoria Hospital? When you come to Victoria Hospital, persons feel you were going to die. One of the things we can say for sure from our data, that a lot of persons who came, especially in the last wave, who came to the Victoria Hospital and passed away, were not vaccinated. We were aware of that. We looked at the vaccinated status of the patients that passed away, and we noticed the large majority of them were unvaccinated. We also realized there was the delay in access or delay of coming to the hospital. It could very well be because what was being circulating on social media. I mean, most persons were getting social media messages where persons were saying, you know, there are not enough staff, persons going to come, you're going to die, do not come here, and a lot of different things that really caused more fear and anxiety in the population. So a lot of persons were not coming to the hospital. They were staying at home, trying to treat themselves, despite the fact that their symptoms were getting really bad. But they really wanted to stay at home because they had a lot of fear coming to the hospital. What happened is that some persons died at home. Other persons, when they really could not anymore, they called the ambulance and they died on the way to the hospital. So when the ambulance brought them to the Victoria Hospital, they were actually dead. They were dead before arrival. We actually had people who died on arrival. As soon as they arrived, they passed away or they crashed, and we had to do CPR. We also had patients who came in so bad when it comes, or they were so extreme in their symptoms or so critical that we had to move them straight from A&E and rush them into ICU or a high dependency unit. That is because they came at a very late stage in their illness. When we spoke to family members, we found out that the person was sick for 2 weeks before or a week and a half before, but they delayed coming in because of fear and they didn't want to die. So I think persons who came in earlier, we realized we had a better clinical outcome from them because they came in earlier on and we could have done more for them, versus those who came in very late, who died on arrival or died before arrival or went straight into ICU, using a lot of our resources, and their clinical outcomes did not come out as we wanted it to be. Despite all of this and all of the complaints, we at the Victoria Hospital, we decided we sat down together and we said we need to make the experience of our patients and the family members of the patients better. If they are fearing or they have a lot of fear to come to the hospital, we need to do the necessaries to improve what we do as a hospital to ensure that they have a better experience as a patient and as the family members who are very worried about their loved ones being admitted in the hospital. We had improved telecommunication services, especially the Wi-Fi. Family members can now speak to their loved ones straight from the ward. You can just log on and you can speak to them. You can FaceTime, you can Facebook, whatever you want, you can actually speak to them. The physicians can now speak to the next of kin regularly without any issues, and that made it easier so the family members can get an update of how the patient is while they're admitted at the hospital. We developed or reviewed our visitation policy as well as our drop-off policy. The visitation policy, we've looked at it, and we always allowed persons to come in. We had more restriction, but now we're allowing persons to come in when we review. Persons who've been there for 1 week or 2 weeks. We have women who came in to deliver and gave birth. We would allow the husband, the partner, to come in. We allow family members of someone who have been in the hospital for a long period of time to come in to visit their family members. We know there are times there are patients who are at the end stage of their life. They're not doing well. We make our responsibility to allow the family members to come in at an appointed time where we allow them to go through with PPE to allow them to go to see their loved ones. We also noticed that there was so much difficulty in the family members viewing the body, especially if you have a family who's COVID-19, who died because of COVID-19. You realize that you cannot see the body thereafter. So we noted, what we did at the hospital is that although we'd have allowed one family member to go in to see the person at the hospital, we work along with the lab, the OKUH lab, as well as the funeral parlors to allow the body to be brought back to the Victoria Hospital morgue, and then the rest of the family can come in at a later date to view the body of the loved one who passed away. In that way, the family have some degree of closure, because not everyone could have come into the hospital to view the family member while the person was alive. All our patients that are coming in, we also give them tissue and water. And if they do not have toiletries, we provide them with toiletries until the family members can bring their items for them at the gate. All of these things we did to make it more comfortable for our patients. We brought in a new cadre of staff called patient welfare assistants, and these particular staff members are like patient advocates. They go to the wards, they help out the patients. We have family members who come at the gate to drop off items. The family members may come in as well to pay for a particular test, which is done at a different hospital, or pay for something else. And this patient welfare assistant work along with the family members and the patients to make their stay at the hospital more comfortable. And that has worked well for many family members, because they feel there's someone on ground who is in touch with the patient and in touch with them to make it easier for them as they wait for their family members at home. At this point, I think I need to thank every single next of kin. And I think the next of kin, in the majority of them, have done a phenomenal job. They've been very excellent, helping out with the majority of the matters that deals with their family. And we want to thank you for that. But we will need you to assist us a bit more so we can make the stay more comfortable for your loved one. We want you to provide us with a correct number, wherever you are, whether in the south, coming from the hospital in the south, whether you're coming from another hospital in the north or a health center, or you're coming to bring your patient in. Please ensure that you give us the correct contact number for you as the next of kin. And that is important. If you have another contact number and you want to leave two for us, that would be well appreciated, because it's very difficult for us at the hospital when we have difficulties in contacting the next of kin. Sometimes it is so difficult that the physicians have to take the picture of the patient who's on the bed, who's alive, or even a deceased patient, send it to me, and then we have to send it to our security chief or our security supervisors, who will have to leave the police, the fire service, or even go to the community and ask someone if they know this particular person, because we cannot get the next of kin simply because a number is erroneous. We have a wrong number, or the number is not functional. So we're asking the next of kin to ensure that you give us a functional number. And if you have two numbers, we'd appreciate two numbers as well. We also want the next of kin to agree with the family members. Family members need to get along, especially for the person who's been admitted. Please decide who will be the next of kin, because we do not want to be speaking to one next of kin and then we have other family members coming in complaining that they do not know anything about the patient, but that physician is already communicating with the documented next of kin. So we expect the next of kin who's documented to be the one to be liaising with the different family members so that they can relay that information. We do not want to be giving too much information out to different people about one patient. So we encourage the family members to understand and to work along with the next of kin. We also allow us asking the next of kin if they can to bring in an ID of the patient who is admitted. They can send it to us via email, they can WhatsApp it to us. It will be good for us as we try to improve our record keeping of the patient. So we ask persons to bring in their ID cards or to send it to us via WhatsApp or email so we can have better charting of our patients. Our drop-off services continue, of course, and we're letting persons know that we would like persons to drop off the breakfast for 7 o'clock in the morning, 7 a.m., lunch at 12, and dinner at 5. Okay, it makes it easier for us to coordinate within ourselves to ensure that the food goes up on time to the patients on the ward. We're also asking the next of kin to please try to not to bring bulky stuff. Do not bring large cases of water, pans of food, electrical items, and all of this. You know, it is a lot. We have to find a place to put it. We have to take care of it. And then if for whatever reason your family members go deteriorate and the physicians need to run in and do CPR, then it becomes difficult because there's so many items around the place, it makes it difficult for them to be able to resuscitate. So we're asking them to bring items, a 2-week supply of clothing, toiletries, face masks, you can bring tea, you can bring milk, you can bring sugar, mosquito repellents, healthy snacks, sanitary napkins, you can bring your cell phones, bring your charger. Okay, these are some other things you can bring that we can deal with, but try to not to bring heavy items or electrical items that can affect us at the hospital. We want to let persons know that the government of St. Lucia has invested significantly in this facility, and we, the staff at the respiratory hospital, will try our best to improve on the care that we give to patients, but we will do our best, but we want you to assist us by doing your part as well. And together we can make the experience for patients and our clinical outcome way better. Thank you.
As Dr. Lucia Eugene Ford here giving us a very comprehensive update on the operations of the respiratory hospital. And as we move on in our programming, this week we saw councillors across the island celebrating Councillors Week. On Tuesday, they gathered at a celebratory ecumenical service to open up the week of activities. And we do have a full report on that by Daniel Dubois from the Ministry of Education.
School Councillors Week 2022 is here and started with a commemorative service on Tuesday at the Zion SDA Church Ravin-Poisson, Bexor. This year, Councillors Week is being observed from the 7th to the 11th of February under the theme Passion, Care and Concern, School Councillors Still Moving Forward. School councillors equip school children with the tools needed to confront their emotional, behavioral, and psychological challenges. They also guide students into career paths that best suit their interests and their ability or talent. Minister with responsibility for education, Honorable Sean Edward, highlighted the profound, invaluable contribution councillors make towards the emotional well-being and protection of young lives by bridging the education gaps, by providing support for every child to function at the mental capacity to be productive. This, according to the minister, helps parents and their children make informed decisions, meet various challenges, and contribute meaningfully to the national economy.
Extremely pleased to be here this morning and to be part of this celebration. Mine is a very, very simple task, and that is to express on behalf of the Prime Minister, the Honorable Philip J. Pierre, and the Cabinet of Ministers, heartfelt congratulations to our school councillors. The spotlight being on you this week is much deserved. Your invaluable contribution to the school system should never go unnoticed or unrecognized.
Guidance and Counseling Coordinator Joycelyn Eugene said counselors provide guidance and support for the emotional well-being of students, and that the onslaught of the pandemic highlighted the value and ever-present space and need for school guidance counselors.
Every year, in the first week of February, we celebrate Councillors Week, and it is because we have a cadre of councillors who are working continuously to serve the children of St. Lucia. We support them in their academic, personal, social, and career development. And so it is important for us to recognize all of those persons who go out and above the call of duty to help students. During the course of the week, we have 2 conferences that we will be holding. Each year, we do 2 aspects of development. This year, we are looking at child online protection, and we have a presenter from overseas who will be joining us virtually.
Councillors were honored for their long-standing contribution and dedication to the field. To conclude the week, councillors are scheduled to have a meeting with the Minister of Education to discuss avenues and opportunities for support, growth, and development. From the Communications Unit of the Ministry of Education, Sustainable Development, Innovation, Science, Technology and Vocational Training, I am Daniel Dubois reporting.
All right, and that's our school councillors celebrating Councillors Week 2022. Lisa, we know that the Education Minister, also having the portfolio for sustainable development, had also an important meeting this week.
Yes, he did meet with the board for the GEF Global Entrepreneurship Fund, the Small Grants Program here in St. Lucia. And the GEF has been doing such great work in St. Lucia, a complete revival of our apiculture industry. Really lies and is credited, through the GEF Small Grants Program. We've seen revival, of farmers on a whole, a lot of environmental programs that are undertaken, a number of water tank projects into some areas that are completely remote. They've been able to assist with that. The projects looking at our wetlands as well. They too have some involvement in that. So the GEF has been doing a lot of work across the spectrum in St. Lucia, even through our schools as well. And so they met with Minister Honorable Sean Edward to bring him up to speed on what they've been doing over the past few years and looking at what their work program is going to be like for the ensuing years. So we go now to that meeting between the minister and the GEF Small Grants Program.
I must say that I'm pretty much satisfied with the way the meeting went. As you probably know, it was a team from the GEF Small Grants Program, and they basically visited to apprise me of some of the work they've done in St. Lucia over the years and some of the things they're looking to do in the various communities here and how they can get government assistance or collaborate with the government of St. Lucia in executing their mandate. So for me, it was a very, very good meeting. I must say that a lot more enlightened in terms of what GEF would have done over the years. And I'm even more excited given some of the plans they have and some of the projects they're looking to undertake in the various communities.
I think we're coming out of here happy that he's understood what we are trying to do. I think he's promised that the partnerships that we've started that are still in the formative stages could be developed more. We're going to be writing to him, of course, to follow up on this meeting today so we can get it in writing. I feel all in all, we have accomplished the objective that we've come here. Informing him, sensitizing him, giving him the relevant literature so he has it to refer to, and putting the faces to the work that's been done in St. Lucia. So he's been able to meet our chair, member of our board, myself, the program assistant, and so on. So it was, I think, by all standards, an excellent introductory meeting.
I think today was a very productive encounter with the minister. I mean, the minister obviously is well informed about the broader issues of sustainable development, but it was an opportunity for us to give him more specific information about what we do at GEF, and also to give him a chance to ask some questions. I think what was instructive is the minister's understanding of the connection between sustainable development, education, and development in general. And the position he holds as minister responsible for these two portfolios is very good for our work because we focus a lot on young people as well, and a lot on education and building awareness on sustainable development. So we are hoping that his own credibility as a minister, his own image, his ability to communicate very effectively, in my view, both English and Creole, will assist us in that messaging.
Okay. Speak to us about the significance of government buy-in to the GEF programs going into this next decade.
Oh, I think it is absolutely necessary. We have global problems in the world today, but they're impacted at the community level. And that is why our program is global and it expands, but we operationalize our philosophies and our actions at the community level. We're in 127 countries around the world. St. Lucia has been one of those. And as we move towards 2040 and so on, the challenges of environmental destruction, the existential threats from climate change, water pollution, soil pollution, all kinds of health issues are going to emerge. And it is programs like that that continue to focus on how we can avert such disasters. And therefore, health has become a critical underlying cross-cutting theme in a lot of the work that we do. health not only of human beings, but health of the environment. And you can't have, they are not mutually exclusive. A healthy environment and a healthy population intertwined, inextricably linked. And therefore we are going to continue to program our activities at the community level, link the community to the policymakers, upscale some of our projects like we've been doing in apiculture, and hopefully get our people to change the way they think, utilizing nature but not destroying nature, using the natural resources but with a mind to the future, and also understanding that there are ways and means to do things better, using science and research and innovation in the kind of work that and goals that we need to set for ourselves in the future.
Environmental management and the preservation of the natural environment, and looking and using the natural resources at our disposal for the creation of livelihoods is something that we are very big on as an administration. I've made the point before that the Department of Sustainable Development on its own cannot fulfill the national mandate, and that we need to collaborate with agencies that share that vision. And I'm happy that the JEF Small Grants Program has come on board, not just to identify some of the work that needs to be done, but there's also a funding component that they bring in, and at a time when the revenue streams of government are not doing as well as they would have under normal circumstances, you welcome that kind of collaboration. And I must say I'm very, very much impressed with the work program, and I'm looking forward to working collaboratively with them in execution of not just the individual projects, but the overall mandate we have in the Department of Sustainable Development.
The Minister for Education there, Honorable Sean Edward, as he spoke there to the meeting that he had with the JEF Small Grants Program. And as I said, Homer's done some wonderful work, and certainly we're looking forward to seeing the further impact of the GEF in St. Lucia.
And that's right, Lisa. I think I agree with you when you say that Jeff has been doing so much work, and one of the important points was made by the chair of the St. Lucia, of GIF St. Lucia, was that the integration with the Sustainable Development Department being also education is a part of it. And Jeff focusing on education of children for that. Because when you think of sustainability and you think of the future of our country, the children do have a very integral role to play. So starting from, from
the tiny tots?
Yes, from the tiny tots. Instilling the importance of sustainability and environmental protection in them, it definitely would augur well for St. Lucia in the future. So I think that was a very good point made there from that meeting. So yes, we do look forward to the future work of the Global Environmental Fund in St. Lucia, and we want to thank them for all the great work that they've done so far. And I think that kind of brings us to the close of our program today. Of course, we want to, always thank you for joining us on the National Television Network Morning Update with Lisa and Hilma. I think you and I, you kind of start our day every day, give us that little boost to go through. So we appreciate that, Lisa.
Yes, indeed we do, and we're looking forward to having you back with us next week when we'll be discussing more of the activities, sort of previewing some of the activities for our independence anniversary. We'll try to stick in some other matters there as well. Still working on matters of the heart for Homer, and so we'll get to that by the time Monday comes around, and we're looking forward to having you with us next week. I'm Lisa Joseph.
I'm Homer DeMarc, and we're wishing you the very best and a very good weekend.
Not anything.